We're finishing up chapter 4, finding out what is wrong, and we need to understand how to perform a physical exam. In the first part, we talked about assessing the scene, understanding what's needed. Now we have to understand, well, what do we do? How do we handle this? And how do we give a physical exam to determine whether or not the cause of injury is significant? And if a person has a head injury, you also have to assume they have a spinal injury. So when you're checking them, those are the most important things because that can be very, very dangerous. So you want to check the head first. For a responsive person, you can ask if they can wiggle their fingers or toes. If they're unresponsive, you need to suspect a spinal injury. Do not move the person's head or neck. Assess the person's entire body. What signs do you see? What conditions can you see, feel, hear, smell? What symptoms are they having at the time? What's their chief complaint? Have the person describe how they're feeling. Then when you're doing the physical exam, remember the acronym DOTS, D-O-T-S. D is for deformity, O for open wounds, T is for tenderness, S is for swelling. So these are the things you're looking at when you're doing a physical exam. There could be significant causes of injuries. So the most important thing is to check the head, eyes, ears, nose, check the mouth. When you are checking, make sure that you also look at the neck and the chest. With the chest, gently press inward. See what you're feeling. You need to check the abdomen. With two hands, one hand over the other, gently press on all four quadrants, upper right, upper left, lower right, and lower left of the abdomen. Check the pelvis. Gently press inward on top of the hip and press downward. Check all four extremities, arms and legs. Check for circulation. Is there any sensation or movement? And check the back. What you're looking for with the skin is to understand what is the condition of the skin based on the temperature of the skin, the color, and the moisture. Skin color that's pink is normal. If it's red and flushed, the blood vessels could be dilated, meaning excess circulation is going to that part of the body. Or if they're pale, they have constricted vessels and it could mean that they have blood loss, or they're in shock, or suffering from hypothermia. If they're blue or cyanotic, they're not getting enough oxygen. And if they're yellow, they're in liver disease or liver failure. Looking at the skin temperature, warm and dry is normal. Hot and dry could be they're exposed, or hot and moist could be they're exposed to excessive heat. And you have to worry about heat stroke. And if it's cool and clammy, that can mean poor circulation. That can also come from shock or heat exhaustion. If it's cold and moist, their body is losing heat rapidly. And if it's cold and dry, they can also have been exposed to a lot of cold and they're losing heat, also known as hypothermia. One other thing to do, some special considerations, try a capillary refill test. Press the fingernail or toenail for a few seconds and release. See how quickly color comes back in, and you'll know if there's good perfusion of blood throughout the body. When there is an injury that you have to get to, you have to expose it. You may have to cut the person's pants or remove a shirt. You have to expose that injury, explain to the person what you're doing. Try to maintain their privacy as best you can and prevent exposure to cold. So you should have some blankets and towels with you always to help you in this type of situation. Check if there's any medical identification tags. Some people are allergic to penicillin, or they have some other medical emergency and they wear a tag, some type of a medical alert. Check their wallet, their purse, and their bracelet or a necklace if they're wearing it. What you need to do is take a sample history. SAMPLE is an acronym and it stands for S is for signs and symptoms, A is for allergies, M is for medications, P is for past medical history, L is for last oral intake, and E is for events leading up to the illness. Then this will help you to know what type of first aid is needed. So with signs and symptoms, ask them what's wrong, where do you hurt? Are you allergic to anything? Are you taking any prescription or non-prescription medications? Have you had this condition before? Do you have any past or recent medical conditions? When was the last time you ate or drank anything? And How did you get hurt? What led to this condition? So these are the basic things in a sample history. What to do when you're waiting for medical help? You have to recheck a serious illness or injury regularly. Do not leave the person. Be calm and reassuring, and that may be the best treatment you can give until medical help arrives. That concludes Chapter 4.